your expertise, and thank you, Mr. Chair.
Thank you, Senator Hassan, and now Senator Banks.
Mr. Wilde, what are the most common fraud schemes in child care assistance programs?
Well, I think that the most common fraud scheme that we experienced was, and I can only speak to Wisconsin and my experience there, was that child care providers would work with parents to effectively create a job which wasn't a real job. The parent would get the child care authorization, the provider would be paid, but they wouldn't ever see the child, nor would they require that that parent to come to work. So in Wisconsin, what we saw was this repeated, and it became a scheme that was sort of well known and replicated. What I would say is that in Wisconsin, this was incredibly concentrated. So it was not. We have 72 counties. Almost 100% of the fraud. Is that my time?
You're okay.
Okay.
Keep going.
So should I stop talking? Almost 100% of the fraud was in a single county. So I think critical is that the fraud wasn't pervasive, wasn't statewide, and at the same time, once it was discovered, it was really critical to dig in on those providers who had again figured out this scheme.
Indiana just launched the Council on Fraud Detection and Prevention, and its purpose is to identify fraud, waste, and abuse in child care and other federally funded programs. Based on your experience in Wisconsin in combating fraud, what should Indiana be looking for?
I think that Indiana should be looking for anomalous patterns, that in trying to identify if there is fraud, the providers are who is receiving the funds. So if there's fraud, the provider is the one who's literally receiving the state funding. I think that the best way to identify it is to identify anomalies. Are there circumstances where it doesn't seem possible that a provider would bill at this level? Are we seeing instances where when a licensor shows up and we know that there are 50 child care authorizations, there are only 3 kids present? So I think it's really using data, both in-person observations, but also data that's collected by the state to find those anomalies and then have a program integrity unit that looks more closely at those.
The Wall Street Journal editorial board contrasted Minnesota with Indiana. And I like that contrast in many different ways. But Minnesota ignored obvious fraud in their Medicaid home care and child care programs, even as their Medicaid spending went up over 60% in 6 years. At the same time, Indiana saved hundreds of millions of dollars by preventing excessive billing and checking eligibility. Why didn't Minnesota have the same type of common sense controls that we did?
I am not familiar enough with what Minnesota has done. Minnesota is Wisconsin's greatest rival, so I'm not sure. Don't feel comfortable speaking to.
Okay, that's fair. How important is it for child care assistance programs to verify that children were cared for, or home care programs to check that care was actually provided, and nutrition assistance programs to confirm that meals were actually served? Would the state of Wisconsin have let a program get away with not actually doing those things?
No, I think it's critical to ensure that kids are actually receiving those services. I also think there are systems in place. I'm not familiar with every state, but certainly there are systems in place to make sure that those things occur. For child and adult care food program, we have both audits and visitors to see that we are serving meals. For Head Start programs, we have regular reviews. For state programs, we have regular licensing visits, and I think it's doing the right things when those regulatory bodies are actually spending time in centers and homes that gets to the result that state.
Dr. Polito, what is direct contracting versus attendance-based funding in child care assistance programs? What's the difference?
So I'm going to need clarification. Direct contract, I believe you're referring to the contract between the state and the center themselves, which is not necessarily something we have started to do. But I'm happy to speak on enrollment versus attendance.
What about attendance-based funding? Is that a concept that you can
explain
to us?
Yeah, so we look at attendance-based funding versus enrollment. I would argue that enrollment is the better benefit for a child care provider who is already, as we've referred to multiple times, working off of razor-thin margins. When you think about most school systems, they get paid on a seat. They don't get paid on how many days?
I'm out of time, but do you
No.
think that attendance-based funding models reduce risk of fraud?
I think we need layers of protection, but enrollment's better.
Thank you. I yield back.